Call to order the meeting of the Mayor and Board of Aldermen for Tuesday, January the 4th. How in the world is it already January the 4th? A couple of changes to our agenda as we get started. I would like to ask you to add at 16A, consider request to release subdivision bond for Lot 10 of Stone Subdivision. And then, Ashley, I believe you have two additions to the consent agenda.
I do. They'll be at 6C. The first one is we have some donations for the ARC from the Odoms, $1,000. That's Sarah and Joseph Odom for $1,000. Clint and Sharon Williford for $100. James Day and Jan Ellen Day, $100. And Jason and Alicia Bolden for $350. Then some volunteers for the ARC is the other item.
All right, thank you, and thank you to those generous donors. All right, so that's an addition at 16A, two additions to the consent agenda. Are there any other additions or changes from any other department head? All right, seeing none, is there a motion to accept the agenda?
Second.
All in favor?
Aye.
Any opposed?
Aye.
Mr. Taylor has joined us on the phone. So, Happy New Year. It is going to be another great year in Oxford, Mississippi. We have got so many exciting plans, and we have already started putting those plans in place, and we aren't going to let COVID or anything else slow us down. So know that your city employees and your mayor and board of aldermen are giving it all we've got, and we are pushing hard to get a lot done in the next 12 months. We will celebrate MLK Day on January the 17th with a program in front of City Hall. It will begin at 10:30, and we'll hear from both Reverend Duncan Gray and Reverend Leroy Wadlington. So it will be an exciting program. We'll walk down Jackson Avenue East to 2nd Baptist and turn around and walk back, and then we'll have a program here on the square. Again, that's at 10:30 on Monday the 17th. I do want to report that we have quite a few employees out that have tested positive with COVID. And I want the community to know that we have 9 people that have tested positive in environmental services. Those are the folks that are picking up your trash, that are picking up litter, that are picking up your recycling. And we're not going to be able to get it all done in a timely manner right now. And so we just ask you to be patient with us. We are going to work as hard as we can go and as fast as we can go, but just know that we're going to be behind in some areas, not just in environmental services, but that's the one that people will notice immediately and will call about. And so I just wanted to make that report that we know we're going to be behind. We apologize in advance, and we just ask for your patience. We've got over half of our building department out right now, so we're slower on doing permits and inspections, and again, we ask for your patience. We have several firefighters out. We have several people in Visit Oxford that are out. If you call phones and don't get an immediate answer, excuse me, then excuse me, and I tested negative. I want to report that. I tested negative. Anyway, I just want the public to know that we are going as hard and fast as we can. Sorry. I was sneezing again. Didn't want to sneeze in the microphone for you again. All right, so that is it for our mayor's report. I would ask you to authorize the approval of the minutes of the special meeting on December 21st and the regular meeting on December 21st as well.
So moved. Second.
All in favor? Any opposed? Authorize the approval of accounts for all city departments.
So moved.
Second. All in favor? Any opposed? All right, I ask you to consider the consent agenda with the 2 items added that Ashley mentioned.
So moved. Second. Second.
All in favor? Any opposed? All right, next on our agenda is to discuss current COVID regulations. We wanted to give you just an update of where we are on COVID numbers and what the city is doing on a daily basis still as we watch these numbers rise. As of this morning, there were 42 COVID patients at Baptist Memorial Hospital, North Mississippi. 8 of those were in ICU. You know, we hear people saying, you know, do something to stop the spread. We would love to. We do believe that wearing a mask does slow the spread, and we ask the public to please consider wearing a mask when they're out in large groups. It is important to note, though, that 73% of the patients who are at Baptist Memorial Hospital are from outside of Lafayette County. So know that when we put things in place, we are trying to really affect the number of folks who are in the hospital, which is a very difficult task when, you know, 30%, only 30% of those in the hospital, or 28% of those in the hospital are actually from Lafayette County. For the months of November, December through January the 2nd, 86% of the patients who entered Baptist Hospital COVID positive were unvaccinated. So that's just hard numbers, folks. 86% were unvaccinated that are in the hospital. I'm hearing people say all over, and it is exactly right. You know, people who are vaccinated are getting COVID. They are. But the large majority of those that are getting COVID who have been vaccinated are not going to the hospital. And so we encourage you, I'm not sure there's anything that can be said at this point that encourages people more or that's different than you've heard before, but the numbers are still there, that 86% of the people who are going into Baptist Hospital with COVID are unvaccinated. Baptist Hospital is not turning away any patients. They do ask that if you simply need to be tested, that you choose a clinic or that you go through the drive-through testing center that's at the Oxford Conference Center. In the Good News Department, the drive-through testing facility that's at the Conference Center has upped their number of daily appointments available from 75 to 250 appointments a day, which is great. It is so convenient. I did it the other day. You drive through, and about the time you get home, they've emailed you to tell you whether you're positive or negative. It is so easy and quick and free. So I encourage people to go to the website and you can see it on the city social media. We've posted it repeatedly with the link that you go to get an appointment to be tested. So we encourage you to do that or go to a clinic unless you have an emergency. Obviously, if you have an emergency, go to the hospital, but if it's non-emergent, we ask you to please leave some space at the emergency room for those who do have emergencies. I'm gonna let Jimmy give you an update, and then I've got a few things I want you to consider.
You've got a handout in front of you, just a real quick, just some data on the variant. The first case of Omicron did not show up in the United States until December the 1st of 2021. And the week ending 12/4 of 21, the CDC publishes data for the variant types. 99.2% of all the cases during that week was the Delta variant, and only about 0.6 was the Omicron. Skip forward to the week ending January the 1st of this year. That switched. About 4.6% of the cases are Delta. Approximately 95.4% of the cases are Omicron. So there's been a total switch. Most of the cases showing up in the United States now are Omicron. A little bit more of the data here. It's about 1.6 times more transmissible than the Delta variant. That's one reason we're seeing this spike in cases throughout not only the Southeast but the United States. As of today, we're sitting in Lafayette County as 10,028 total confirmed cases. We had an increase of 155 cases today, and we've had 143 deaths overall. On the positive side, 58% of the Lafayette County citizens have received at least one vaccination. 53% are totally vaccinated. We don't have a breakdown of how many in Lafayette County have been boosted, but 31% of the Mississippi population has received the booster vaccine as of now. And the CDC's recommendations is there is going to be breakthrough from vaccinated from the Omicron virus. or the Omicron variant, but its effects are less severe. Like the mayor said, the hospitalizations are a lot lower if you've been vaccinated and boosted and you do get the Omicron variant and everything than if you're unvaccinated. So that's the key, is
So more contagious, less severe.
more contagious, less severe if you're vaccinated and boosted.
Right.
So.
All right, does anybody have any questions for Jimmy? Okay, a few things that I would like for the board to consider. We have had some restaurants who are interested in offering curbside delivery. I made an executive decision to let them start doing that this past week, but we need board approval to move forward with that. We have 8 restaurants, I believe, Matt, is that correct? Who are currently taking advantage of the opportunity to go back to offering some curbside services. And I think there are 4 more that are thinking about it and may want to be added. So my recommendation to you would be to allow 1 parking spot for each restaurant, each dine-in restaurant that would like to offer this curbside option again. I think that's certainly one of the safest ways for us to support our businesses and be as safe as possible, as people using curbside pickup but still ordering out. So I would ask the board for your permission for our parking division to allow for just for 2 weeks. I would say, you know, we can consider it again in 2 weeks. All right, all in favor? Any opposed? We have had a request from Micah Quinn at the Oxford Conference Center, actually a question and request. They will host on Saturday the huge indoor yard sale. And with numbers climbing like they are, they would like to ask guests to wear a mask in that crowded event. So I think it's a good time for us to talk about with city employees coming down with COVID one after the other. Would you consider asking people or requiring people to wear masks in city buildings for the next 2 weeks? Would, I think that would, I would say, other than those who are exercising, I don't think that the youth playing basketball would be required to wear masks, or people that are exercising at the activity center, as we've been through before. But just, that is for y'all's discussion. I just throw it out there for your discussion.
I think it goes back to the social distancing. You know, you're in City Hall and you can social distance and you have, you know, your space and you have the protective barriers. I don't think it's required, but when you have an indoor yard sale that you can't social distance, like any other business, they have the right to require a mask for everything. You can't control, you know, what people are gonna do.
I mean, I think that makes sense.
So, yeah, I'll make that a motion.
Okay, what, I don't know what the motion is. What, I mean,
I don't think we would need to require it in all city buildings, but I think it ought to be required for the indoor yard sale.
okay.
Or social, you
Or
cannot
where you
socially
can't
distance.
social distance.
You cannot socially distance in any city building, you need to have a mask.
Sorry. That's fine.
Did you second that?
I will now.
Okay.
All right, so the motion is that you're required to wear a mask in city buildings when social distancing is not possible.
Except for sporting events. I mean, do y'all need to make that sporting events because they don't social distance play basketball? That's
During exercise,
Why don't I resend my motion and you make it?
I'm just trying to think through before I see both of us.
I think while you're exercising, I mean,
Seth, does that give you enough clarity for the activity center if we say while people are exercising? I know that will be the first question, and as of now, we've not been told that the schools are going to require masks. If they're not wearing a mask all day at school, I'm not sure it makes a difference if they wear one in the evening
I agree.
playing basketball. I don't think that makes any sense. So, I mean, if something changes with the schools, we may want to rethink it, but as of now, there's no requirement in the schools to wear a mask, so I don't think it makes much sense for them to have to wear one after school doing that. Do you need more clarity, Seth, or?
So, I mean, basketball practices are doing now, basketball games, the league season starts next week.
Yeah.
Whatever y'all say, we'll work it out. I mean, it's obviously the bulk of the people in there will be playing basketball, and it'll be just a thing, it'll just be spectators and parents around there, so it'll be.
How do y'all feel about spectators and parents in the city building wearing the masks?
I think they should.
I agree.
I think that makes it social distance, and some of those depend upon the size of the crowd.
Having 2 kids going through there, it's impossible
To social distance?
to social distance with the amount of bleachers and standing room and whatnot. I mean, you could do it, but there's no way to enforce anybody from social distancing. They're not gonna, there won't be any social distancing for spectators.
But I think that we need to amend the motion to just, to the spectators in that building. I like your motion about other city buildings, that if they can socially distance, they shouldn't have to.
Okay, so y'all tell me. Somebody start over with the motion.
Make a motion to wear a mask in city buildings
Second.
when social distancing is not possible, but does not include while you're exercising.
Okay,
That's clear.
And that way, he can handle it.
That's
by
right.
just with a sign that says spectators,
yep, okay.
Is that cleared up?
yeah.
I
Second,
mean, if you want to be as clear as possible, you say all spectators in the activity center.
he can just have a sign up.
Required.
So we have a motion.
And a second.
Second half of
Pardon me?
Taylor second.
Oh, okay, yes, he did. All right, we have a motion and a second, all in favor? Any opposed? All right, that is it for me. Does anybody else have anything else that they would like us to consider or discuss? All right, if not, we will move on to our next agenda item, which is adopt a resolution declaring the necessity for the sale and issuance of a general obligation note of the city in a principal amount of not to exceed $2.9 million for the purpose of raising money to pay the cost of repairing, improving, adorning, and equipping municipal buildings, adoring it, little typo there, and equipping municipal buildings and purchasing machinery and equipment which has a useful life in excess of 10 years, authorizing the publication of a notice of note sale in connection with said note, and the preparation and distribution of information and materials related to the sale and issues of said note and for related purposes. Welcome, Sue Fairbank.
Thank you, Mayor. So this is the initial step in issuing a 5-year note to pay for some heavy equipment that the city is interested in, has ordered, I believe, and is purchasing, and then doing some improvements to city buildings.
Right, this is for the boards, just refresh your memory, this is all of the equipment that Environmental Services has budgeted for this year, and it's also $750,000 for design and engineering steps towards road projects, swimming pool, enterprise center renovation, and the OPC building. Just, I think, isn't that right, Ashley?
A little bit of everything.
Yeah, okay.
So this is the initial step. So we will come back and after you adopt this resolution, we'll come back, we'll send out the information to potential purchasers, come back February 1st and award the sale of the note, and then close shortly after that. So you would have money early February.
Okay. Does anyone have any questions for Sue?
Motion made.
Second.
All in favor? Any opposed? Thank you.
Thank you.
Request permission for multiple apprentice linemen to attend TVPPA apprentice lineman training in Jackson, Tennessee and Huntsville, Alabama, at an estimated cost of $11,349.25. Rob?
Thank you, Mayor. As you probably see if you review the item, this is for 8 separate travel events for our linemen throughout the year. They're working their way up from class 1 through all the way through class 10, and so we've got 3 or 4 linemen now that are in apprentice training, and so this will be, it's in the budget, and it's what we need for our linemen to get trained for the year.
Second.
All in favor? Any opposed? Second reading and public hearing for proposed ordinance to rezone approximately .53 acres for case 2816 for property owned by Oxford Farms LLC from institutional education and a portion of unzoned former right-of-way to traditional neighborhood business for property located at the South Lamar Boulevard and Belk Boulevard roundabout, being further identified as PPIN 8854. Ben?
Yes, ma'am. As at our last meeting, we discussed this rezoning request. Nothing has changed since that time. We have not received any comment from the public.
We received one email this afternoon in opposition.
Okay.
If you'll send that to me, I'll make it part of it.
Okay. Anybody have any questions for Ben? All right, this is a second reading and public hearing, so is there anyone here who would like to speak on this topic? All right. None being heard. Do y'all want to make a motion tonight or wait until the next?
Without anybody here to say anything during the public hearing, I'll make a motion.
Second.
All right, all in favor?
Aye.
Any opposed? All right, and Ashley, that one statement is emailed to you.
Okay, thank you.
Thank you, Ben. Consider a resolution of the Mayor and Board of Aldermen requesting that the Alcohol Beverage Control Commission extend the hours for alcohol service for the Super Bowl on Sunday, February the 13th. DC Mayton?
This is an annual event the city has done entertained before. We're just asking for the extension of alcohol sales on that Sunday for Super Bowl.
So moved.
All in favor?
Aye.
Any opposed? All right, request permission to accept a donation in the amount of $5,000, and there's a typo, that's from Nicholas Air Services, for the purchase of equipment for the Oxford Police Department, and a thank you to Nicholas Air for that generous contribution.
So moved.
All in favor?
Aye.
Any opposed? Request permission to submit a budget modification request to the Mississippi Office of Highway Safety for the 405D Alcohol and Drug Impaired Driving Grant for training coordination.
What this is we had to do an adjustment for salaries for those officers that are assigned to this because of the change in salaries. The money is there. The state cannot make an adjustment until February 1st, so we're asking that money that they have place now for that grant to be utilized for that, and then the state will reimburse on that end.
So moved.
Second.
All in favor?
Aye.
Any opposed? Same thing. Request permission to submit a budget modification request to the Mississippi Office of Highway Safety for the 405D Alcohol and Drug Impaired Driving Grant, but this is for enforcement.
Motion made.
Second.
All in favor?
Aye.
Any opposed? Thank you, Sheridan. Request permission to accept the proposals received and select a financial institution for municipal depository services for calendar years 2022 through 2025.
Yes, yeah, our depository services 2.0. As was attached to the board pack, we did take proposals again for the second round. We had the same 3 people that put in. I am recommending that we go with Origin Bank for a 2-year period at a fixed rate of 0.15%. I just can't bring myself to lock it in for 4 years when rates are so low right now. We should have a chance, give us a chance to readjust later if we want to.
All right. Questions from the board?
I think it's a good move. So moved.
Second.
All in favor?
Aye.
Any opposed? Thank you. Rihanna, are you on the line?
I am.
All right. Next, we have consider a contract renewal with Eagle Specialty for traffic signal maintenance.
Yes, this is our annual contract we have with Larry Fauner of Eagle Specialty, and he has been maintaining our signal for a number of years, and we just would like to renew this 1-year contract.
All right. Does
Motion
any?
made. Second.
All in favor?
Aye.
Any opposed? And then the item that we added, consider request to release subdivision bond for Lot 10 and Stone subdivision.
Yes, we would request that we release this bond. It is for this subdivision. It's the 2 houses at the corner of College Hill, Jackson Avenue, and Washington. That they created a subdivision there, and they would like to release the bond now that they've completed all of the required infrastructure.
All right,
So I would just ask.
all right, all in favor? Any opposed? Consider a contract with HDR Engineering, Inc. for general professional services.
Yes. This is again another contract renewal. HDR has been providing these general services to us for a number of years, and most recently we've been using them to help us evaluate the design on the more complex roundabouts that engineers are submitting to us now.
Motion made to approve.
Second.
All in favor?
Aye.
Any opposed? Consider the selection of Wagoner Engineering, Inc. for the Highway 7 University Avenue intersection improvement project. Praise the Lord.
Yes, it's very exciting. We, to select the engineer from this, we asked MDOT for permission to select from their master contract list. We received proposals from 3 engineers on their list, and we evaluated those on a number of factors and selected Wagner Engineering to recommend to the board for professional services. Because of the funding, because this is going through the LPA process per the MOA, MDOT does have to concur with our request, and they will have requirements on the contract and different steps along the way. So I would ask that the board, if they make the motion to select Wagner, would grant permission to the mayor to sign a negotiated contract, and it would all be pending concurrence by MDOT and approval by legal counsel.
All right, would anyone like to make a motion with all of that included?
Yes.
All right, a motion and second, all in favor?
Aye.
Any opposed? We have talked about hospital wing in a previous work session, and so Braxton is here to talk about our Sun Life insurance rates and to revisit the contract with hospital wing.
All right, first let's do the Sun Life. We finally got their quote back. They've proposed an 80-cent increase to our premium. This is for our $20,000 mandatory policy. The city pays 40% of that premium, so that's going to increase our annual premium by $1,400 approximately, and each employees will go up around $5 per year per employee. But I do recommend approval on that.
So how much?
$5, roughly $5.04 per employee per year, and the city's contribution will go up $1,400 total approximately.
That's not what your memorandum said, just making sure.
Well, I just did the math right here.
Each employee would see an increase to $4 from $3.58.
Yeah, it's 42 cents.
So 50 cents a month, which
Yeah.
gives you the,
Yeah, 42 cents per employee difference per month. So $5.04 for the year.
So moved.
Second.
all in favor?
Aye.
Any opposed? All right, and hospital wing.
And Brian, were you able to?
Yeah, here's, all right, I've reviewed the contract and spoken with someone who's in the industry in Colorado. Here are my problems with this. First is, and this is consideration not only of the proposal to purchase this for the entire city, but it also deals with purchasing it for our employees. Under the general law is you have 2 bills that, one is the No Surprise Act, and that's federal, and the other one is the Balanced Billing Act, which is state. That applies to out of network. So in other words, if your insurance company is out of network and doesn't contract with Air Med Care, then they have to accept the contract rate. If you are in network, which I believe we are in network, they can only accept the contract rate. So the purpose of this would be, is we're paying $25,000 for nothing more than covering deductible of $1,000 in copay. They cannot go out, these agreements, that's what it is, they're trying to say. But it also provides them a lot of rights that I'm not too comfortable with, and one is it provides them a right of full any payment received through insurance from a third party, meaning if you're in a car accident, and you get a liability settlement of let's just say $100,000, they have first rights over you, over the person in the accident. This agreement gives them first rights to be reimbursed.
I think you've said enough.
I just don't, I mean, there's a lot in this that I can go over. Lastly, in 5, it says that we're certifying that the people are not Medicaid beneficiaries. I mean, how do we certify that? How do I tell somebody that's a Medicaid beneficiary that, oh, we're paying $98,000 and you're protected, and then they're not? So I would not recommend this. And I guess the most important, less than 1% of their revenue comes from individuals, meaning it's all insurance, and they take the insurance and don't. There is a bill being presented throughout the United States to exclude this exact type of agreement, because in essence, that's how they're going to make their money. They don't make it from individuals, they make it from these agreements. So I question, again, I'm fine, I don't want an employee of the city of Oxford to have to pay $1,000 deductible if they're air flighted, but my understanding, Braxton, is we've had 2 air flights over the career of this agreement.
Well, since I've been here, I don't even.
But that $1,000 deductible, basically they would just have to pay the remaining of whatever their $1,000 deductible is, right? Or is it $1,000?
No, under this agreement, they're not going to come and ask for your deductible.
Right, I know that, but what I'm saying is that that's the Blue Cross deductible?
Yeah, that's the total.
Right, that's what I'm saying. So if their deductible may be $200 if they had a.
Sure.
Yeah, that's sure. Okay. They have the $1,000 anyway, is what I'm saying. It's part of their medical plan.
So the point being is that not only would I not recommend spending $98,000 to cover the city of Oxford, I question whether the $25,000 for the city of employees is a good deal for us, and when the money can be used in many other places to help the city and its citizens.
Yeah. I appreciate the time that you invested in researching that for us.
Sure.
Very much. I'm in full agreement. I'm not sure that it's a worthy investment on behalf of the citizens or our employees for that matter. So anybody else have any questions or input?
Thank you. Thank you, Brian.
Yeah, absolutely. Thank you. All right, then I would ask the board to consider an executive session.
Second.
All in favor? Any opposed? All right, the board will now consider an executive session.